Schwartz. Thanks for joining us. This is our COVID cast. We've been doing quite a bit of these and speaking to experts in a variety of fields, from technology to manufacturing to now healthcare. And it's myself. I'm Luke Bonner, the Senior Economic Development Advisor for the City of Sterling Heights. Stacy Jarko is the President and CEO of the Sterling Heights Chamber. And Steve Couchman is with Live Picture. He is our technology backbone for all these COVID casts. So again, thanks for joining us. Particularly interested now as things are starting to, at least in Michigan, starting to really open. Manufacturing was allowed to kick off again this past week. I know Lear in particular put together, kind of the back to work playbook. There still seems to be a lot of confusion about, all of this stuff. I think big business has a lot of resource in terms of the things that they're putting into place in their workplace. But I'll give you a really good example of confusion. For example, under the governor's order for allowing, business to go back to work, they have to have a plan in place. And there's a requirement that these plans have to be submitted to the local unit of government. So, KUKA Systems, America's headquarters is in Sterling Heights. Well, their, chief compliance officer an email and said, "Hey, we're supposed to send this plan to you. Do I send it to you, or who do I send it to?" It's like, right. All of a sudden inundated with all of these plans supposedly submitted. But aside from that, we talked last week about testing in particular, and kind of so many variables in testing. I guess I'm just sort of interested from your experience right now in what you're working on. Can you talk to us about from a business, the right things that businesses should be doing as it pertains to a safe workplace for clients, customers, and for employees, and sort of some best practices to adhere to?
Absolutely. And right off the bat, just to get the testing piece out of the way, because that's one of the things people ask a lot about, is trying to understand, does testing feed into my return to work or not? And generally speaking, testing does not. When you look at a PCR type testing, is really based on somebody having some type of symptom that makes a clinician say, "I need this information to determine, do you have this infection or not?" And that's when you see the nasopharyngeal swab that gets sent off and it comes back that either you have the infection or you don't. There have been variances on that type of testing. People have heard about the Abbott machine. It's one you'll see sometimes on TV that came out. It's under an emergency use authorization. So it does not have FDA approval, but what it looks at is the nucleic acid of the virus to early detection. Another one that's been in the news recently is called an antigen testing. Seidel has come up with this antigen test that is now just coming on the market, that actually looks at particles of the virus to say, yes, you have an acute infection, no, you don't. The thing about that test is, again, it's going to take time to get it out. It probably won't be till fall, so you'll see it routinely in non-hospital settings. But that test also is only good to say, if it comes back positive, great. If it comes back negative, they say you can't rely on that. You need to do another test if you think the person has symptoms. So that's really, those are medical toolboxes. The other one we hear a lot about is serology. The serology testing is the one that is being extremely heavily marketed to businesses. If the businesses in your area in Sterling Heights have not received things by email yet on these, I'll be shocked, because these companies are pounding different organizations, governments, et cetera, saying, "Hey, buy our test." These tests also are not FDA approved. There's over 200 of them on the market. They were allowed under what's called an emergency use application. Basically, the FDA said, we don't have time to look at all this information. If you submit an application, then we're going to say, okay, you can go sell your test, even though it hasn't been reviewed. Well, that has miserably failed, as they found that there's a lot of fraudulent tests on the market. They're not accurate. They don't give the information people need. And so now the FDA is going after these groups. They have given, I think it's up to 13 now, companies that do serological testing emergency use authorization. Again, not FDA approved. It means they've reviewed the application and said, okay, this looks good, go test it. But I will tell you again, all these tests have a lot of bias based on how they test them. And so one of the things that's so important is understanding the prevalence of a disease in a community. How many people in the community have it to validate whether a test is accurate or not, or whether it'll work. Serological testing, because again, people are going to be hearing about it, should only be used for right now for basically two things. Number one, for population health. We know that influenza, every one person who gets influenza gives it to 1.3 people. We really don't know with COVID what that spread rate is. In a closed environment, one study had a case where people at church, one person had it, the whole choir was together singing, and over half of the population ended up getting a church population in the choir. So it was a 1 to 17 spread. They believe in the community it's probably 1 to 2, 1 to 3. In New York, they initially thought it was 1 to 7. So why am I sharing all this? Well, serological testing, though it's not perfectly accurate, can still give us a better idea of within a enclosed community what the prevalence rate is. So this is used by epidemiologists. This is used by public health groups. The other place that serological testing does have a point is that someone who had COVID-19, or is pretty sure they had it, and they want to donate plasma so that that can be taken and made in what's called convalescent serum to treat those that are very ill as a possible treatment. And we've had, I will show you in our organization, we've had 5 people who were convinced they had COVID-19 and wanted to donate plasma, and so far all those tests have come back negative. And I share that because everything that happens is not COVID-19. There's a lot of illnesses we've all experienced, flu, viruses, other things during this time of year that we've always seen. But again, right now people are very afraid, appropriately, that it is COVID-19, but a lot of these cases probably were not. When you look at return to work, that's probably where we really need to talk. As you look at your business, what can they do to be safe, to bring people back? And it's really interesting. There was an article, and then I will show you the cover, from May 13th in the New Yorker. And it's called Amid the Coronavirus Crisis, a Regiment for Reentry. And I find this article, and you can find it on the internet, to be really good when you look at businesses and you start talking about reentry strategy. And it was written by a physician in one of the Boston hospitals, and looking at what they did to stay safe, looking at a nursing home, and then really talking about community. How do we make communities safe? And they really came up with 4 pillars or strategies, and they really fall behind hygiene, distancing, screening, and masks. But in order for any of these to work, in your community, they really express in this article, you have to have a change in community. The community has to adopt and be willing to make changes that are different than before. Generally we think of things we do to prevent something. We may do something that will keep us safe. So I may take a medication or isolate myself or stay away from somebody because I'm trying to stay safe. But when you look at COVID-19 and the cultural change that has to happen in the community, we have to start thinking at what do I do to keep you safe? So let's talk about those 4 pillars. Hygiene, number one most important thing to occur in businesses, frequent hand washing. Hand washing with soap, at least 20 minutes, get between the fingers and wash. Anytime you think you might have touched something, or you accidentally cough in your hands, or you sneeze, wash your hands. Using sanitizer. These things all will help keep people safe. Our hands, it's not that our hands are going to get a virus and it's just going to absorb through our hand. But what do we do with our hands all the time? Start watching people. You'll be amazed how many times they touch their face, their mouth, their nose, or they touch a pen and then they put the pen in their mouth. These type things are taking a virus and transmitting it right into them. So proper hygiene. Distancing. So let's talk about distancing. Where did the 6 feet come from? Well, if you go back, and they even talk about in this article and others that I've read, years and years ago, they actually just talked about 3 feet. And then there was a case of meningitis in, I believe it was Texas. And one child ended up spreading it to about 30 children. And when they went in there and they really tried to study what the spread, because back then they thought if you keep people 3 feet apart, they found that, no, 3 feet wasn't enough. And so now it's 6 feet. And they've done all sorts of studies measuring distance of spread when we talk, when we cough. The thing that spreads things the farthest is when we sneeze. And are there people who can sometimes spread a viral load greater than 6 feet? Absolutely. But for the most part, 6 feet is a pretty good measurement. So again, really looking at businesses and saying, when people come into my business or when they're coming to work and they're manufacturing, how do we at least have 6 feet between people? And really that leads into mask. So what does a mask do? Mask really has 3 purposes. One, when we talk about 6 feet, if you have a mask on, it reduces that distance because the mask keeps you from spraying the same distance if you don't have a mask. So again, it's how do I protect others from me, not necessarily me from others. And that's why it's so important from a community standpoint that everybody adopts wearing masks when they're in a proximity of each other. 2 other things masks can do. Number one, if you have a mask on, it's kind of hard to touch your mouth and your nose. So it gives you a barrier, again, to help prevent that entry if you've touched something that has virus on it and then touch your face. Doesn't protect your eyes, so again, we got to really be conscious not to rub our eyes and do those things. The third thing it does, and it's one of the things with signage that can very much help, teaching people you don't take your mask off until you've washed your hands or used hand sanitizer. So it's another barrier, another reminder to do the right thing before we do this. And this will help, again, your community. It'll help those businesses within your community as they adopt this. The final piece is screening. So let's talk about screening. Number one, for all businesses, please, if you do nothing else, make sure that every single person in your organization understands, do not come to work if you're sick. Whatever policies you need to change, adjust, sick leave, do not come to work if you're sick. That's really where the temperature monitoring comes in when we look at screening. So is temperature monitoring a good thing or bad thing? My answer will be, it depends what you're trying to accomplish. Some questions that are important for businesses to ask themselves about temperature monitoring if they adopt it. And again, we have many companies that we work with that are doing it. Number one, if I start it, what is it going to take to stop it? So do I continue temperature monitoring until we see a decrease in cases? Do I continue temperature monitoring until we have a vaccine? What are the rules? And at least to start thinking about that. Number two, recognition that temperature monitoring will not give you 100% protection. There are people who, if they need to come to work because they need to feed their family and they're on hourly and they feel they must come to work, we've seen it our whole lives. They'll take Tylenol, they'll take ibuprofen. We may have done it ourselves and they go to work. And even though they do that, they're still putting other people at risk. What does temperature monitoring do? Well, number one, it tells people, please stay home if you're sick, and we're going to double check. Please be very conscientious of what's going on in your body. Number two, it tells other employees that we are trying to do what we can to keep you safe. The final thing with temperature monitoring is make sure you have a protocol. What happens if someone's positive? Does that mean that you have an area in your business where they can step aside and call their doctor? Does that mean they go home right away? Ideally, we recommend if you're using a forehead laser thermometer that you recheck somebody who's abnormal with an oral temperature. We're seeing some groups as the weather's getting hot, if they've been in a hot car and they come in and bam, you zap them right then, they're gonna have 102, 103 temp. It's not their temperature. It's just because they got out of a hot car. Let them sit there for 5 minutes in a cool area, then recheck them. Having these things determined up front will help you. But it still goes back to the same thing with screening. Make sure that people ask themselves the questions every day. Do I have the sniffles? Do I have a cough? Am I sneezing? Am I achy? Do I have a sore throat? Really just to do a self-check, if nothing else, of do I have any symptoms? Is anybody I'm around have symptoms? Am I running a fever? And if they are, they should seek medical care because our goal is to keep those people from exposing others. So my last remark would be, if you take these pillars, which I thought was very well written in this article, And then you put those together, what it comes down to is universal precautions. We come together as a community, making changes of how do I protect you from me, not how do I protect me from you. And with that change in thoughts and making sure we have the right things for hygiene, making sure that we look, is everybody touching that same door to get in the building? If they are, then you need to have hand sanitizer on the other side of that door, or maybe paper towels, or maybe bridge that door open. Look for all those areas that have multiple touches. If you have a break room, is everybody touching the same refrigerator handle, the same microwave handle? Do you have wipes to wipe down those handles? Or do you have a barrier, a paper towel, a glove that people can wear if they have to open the refrigerator, touch the microwave, touch the copier? Set up a policy if you have areas that people have workstations, that when they come in, they wipe down their workstation, they wipe down their keyboard, they wipe down their phone when they come to work, and they do the same thing when they leave work. If we do these things together as a community, we will bring down the spread of COVID-19 and we will protect each other.
Dr. Schwartz, you talked about, used a great term, safety engineering, and you started to get into that a little bit. How important is it? We've seen in a lot of workplaces, especially manufacturing facilities, where there's an OSHA plan or my OSHA plan and how to deal with certain things. How important is it? And do you think that companies are already creating sort of these safety engineering plans and posting them anywhere and wherever, and consistently working with their employees to follow those guidelines?
I've seen huge variances with that, Luke. I think, well, number one, OSHA has a wonderful document on their website. People have not gone out and pulled that website off, pulled that document off the website. Please do. It's an outstanding document. It's interesting when you look at safety engineering. I was talking to an organization the other day, and boy, it sounded like they did everything really well. They had PPE there, personal protective equipment. They had separated out where employees' workstations were, so they had enough distance. They really had bright signage. They had wipes. They had set up their cafeteria different so people couldn't sit close together. They had really done a lot well. So then I asked a very simple question. Tell me about when you come to work, just take me through an average employee. Tell me how they get in the building and what they do next. So when it came to getting in the building, they actually had the doors open and they had somebody outside to make sure people got in so everybody's touching the handle. But here's where they messed up. They have a time clock and everybody has to punch in, and they swipe their card and then it takes a thumbprint. So everybody was touching the same machine, one person after another, with their hands in order to get that thumbprint after they swiped their card. And I said, well, what do they do after that? Well, maybe we should encourage them to go wash their hands in the bathroom after that. Okay. How do they get to the bathroom? And again, it was multiple touches on similar things just to get in the door of the bathroom. So what I recommend when you look at safety engineering, despite following all the OSHA guidelines and looking at the big things, take your employees, pick different employees in different roles, and start as that employee outside the building and go through each step of how do I get in the building, how do I get to my workstation, and what do I do during the day? We had one organization we worked with that was manufacturing, and in kind of walking through those thoughts, they very quickly identified that in one area of their manufacturing, there is a drill that hangs down and 4 people use the same drill. So they hadn't really thought about that as much. So very quickly with them, we changed the process for those employees. All of them have to wear the neoprene gloves. So that even though they have to touch the same drill, now the workstation is different of how they do it. So really walking through the eyes of your different employees and their different positions will be very helpful. For your businesses, walk through it from not only as an employee, now think about it as a customer. What happens depending on your business? What are those things that your customer may touch? Are there things that they touch that need to be wiped down afterward? If it's a restaurant, how do they get into the bathroom? What does that bathroom look like? Does it have automatic water dispensers? Does it have soap? Do you have appropriate signage? You know, we've all seen the signs that say, if you're a worker, please stop and wash your hands. Now we need to say, if you're a human being, please stop and wash your hands. And changing that reminder so it grabs people to get them to do something, and just pause for a minute and say, you know, a sign that says, please use a paper towel to open the door when you're leaving, and having a garbage can there. It's amazing. We look at signage if it's at eye level and we stop and we think, but we've all built habits over our lifetimes. So even though we hear about COVID all the time, when we re-enter into the normal world, we can't help it. We go back to our normal habits.
I think people have a great deal of trust in, number one, their employer, that like you mentioned, while there's few protocols in place, you know, the thumb scan, for example, it must be okay. Going to the bathroom, it must be okay because they're doing everything else. But that may not necessarily be the case. And I do think for the success of a small business, that there is a lot of trust in customers, that they are clearly, openly, and transparently making their store or what have you as clean as possible and that sort of thing. Do you think it's important to have almost like a health coach on the floor, you know, constantly walking around, kind of reminding people of what to do and when to do it?
It would not hurt. I think the more reminders, I mean, we're building new habits, is very helpful. I think the other thing that businesses can do, people are afraid right now. I mean, there's a lot of workers that are nervous. There are some businesses where the workers may feel that their employer is more concerned about profit and getting back open than they are about the employee. And these things aren't necessarily true at all, but the perception that individual, as people have fear can overwhelm our thoughts. So one of the things that can be very helpful for employers also, if they have the ability to do a short video and, you know, show it in the cafeteria or show it in meetings, to show, here are all the things that we are doing to keep your work site safe. Or even if you can't do a video, in a meeting, have a meeting with your employees and share with them everything you're doing. I think it's important for customers too, to have that confidence that what are they doing to keep me safe? I will tell you, one of the restaurants where I live, that's a little community restaurant, has done the most amazing job of communicating that their new norm, and their new norm is customer focused and safety focused. And they've actually been one of the restaurants that, you know, you hear people talking about, hey, I'm comfortable going there. So I think it's educate, and don't be afraid to share with people what you're doing to help them. Because again, going back to what I said earlier, as we build this, you know, this new, what our communities look like, and that support of each other, when you share with them what I'm doing to protect you, it helps somebody else realize that they have a responsibility, what they need to do to protect everybody else.
It's actually something that we talked about this morning, you know, as the chamber goes to reopen, you know, we cleaned and sanitized our office. That was the first thing. Now, truthfully, I can talk to every expert out there, and they said we'd been closed at the time for probably 9 weeks by the time that we cleaned. Didn't really need, it wasn't a, you know, requirement. They said, you know what, it's been long enough, but it made my staff and my team feel much more comfortable with the prospect of coming back to work, knowing that we fogged everything was clean. They're going to walk into like this pristine environment. And so we did talk this morning about doing a video with one of our members, 30 seconds, that shows a little bit about what we're doing internally. But also then, you know, we might tell people, you can't come into our office without an appointment. We're ordering single-use pens, cheapest pens I can find, so that you take that pen with you, so that we're not sharing, you know, the same one back and forth. And just trying to be, because we're a forward-facing organization, so people come in often. So we're trying to make sure that we don't close that part of ourselves up, because it's part of who we are and how we serve our community too. But also making sure that the people behind the scenes stay safe too.
That's awesome. I mean, we're
trying.
And I think, you know, I look at Costco. You know, I've been impressed with Costco, because if somebody doesn't have a mask and they walk in there, they have a mask right there to hand. Mm-hmm. So they've really changed their culture. And there are some people who, we've all seen it in the papers, who have said, well, I'm not going to Costco anymore. And that's okay. But they've really established a culture of community. And they've also said, listen, you're not perfect. You may not have a mask. You may not be able to afford a mask. You may have forgot a mask. We've got you covered here because we want you to come into our business. And I think that's a good model. There is, if you take any one thing, what was fascinating in this article, and they were looking at some studies, and they looked at actually a nursing home that only did 3 of the pillars, and they had an outbreak. They had cases. And when they then went back and adopted, hygiene, distancing, screening, and mask, all of a sudden now their cases have gone away. And so I think the one thing that we have to remind people, it's one thing by itself is not perfect. And so when you start stacking all these different things on top of each other, and that gives us that extra filter, and the more filters it goes through, the better chance we have of not spreading it to each other. And, listen, this is a bizarre situation. I mean, none of us have ever dealt with this. I've been practicing for over 25 years. I've never seen anything like this because we have no immunity. It spreads pretty easy. And so it's really establishing that new norm. And I think businesses, the biggest question I get a lot of times is, well, what do you think about businesses opening? That's kind of a loaded question. I think our communities do need to get back to a new normal. I think our companies, businesses, the world could have gotten back probably quicker if everybody was willing to do the right thing. And again, follow the hygiene, distancing, screening, and mask. If we do the right thing together as a community, you're going to see spread go way down. And they've seen that in these microcosms of communities. Look at hospitals. Look at nursing homes. Look at all these other areas. When they've done the right things, they're not seeing the cases. So then when you look at your community, if everybody comes together and says, I'm going to protect you from me and I'm going to do these things, I think you guys will be really safe and really do a good job reopening. If people decide hither skither whether they're going to accept and do these things, you're going to have challenges.
Yeah, what I've been saying lately is, this country's been founded on civil disobedience, and it continues and has continued throughout our short history. And we also have the ability to really rally around causes and really unite as a country. But I unfortunately have seen politics drive a wedge into, is this a political deal, or is this really something we ought to be doing? And I completely agree with you. I mean, if you look at, some of the other countries across the world that are more orderly in nature, and their government has rolled out sort of these plans and people have followed them, the amount of cases have dropped fairly significantly. Have gone back to more of a social distancing norm, more quickly than we have. And I hope that the message, changes here over the next 45 days in Michigan as things start to open up. And for example, with the UP opening up on the verge of Memorial Day weekend, you're going to have loads of people rushing up north to hang out and go to the bars and restaurants and fish and swim and everything else. And, we hope that, as kind of like a trusting measure and sort of a morale measure with, fellow Michiganders, that they're going to follow the right things and not perpetuate what we've been dealing with here the last 2 months.
Now I will share, I am completely non-political and yet the politics have caused more challenges for us clinically and caused more challenges from a science standpoint. There's so much misinformation, there's so much finger pointing, there's so much anger. We got to put all that away. You just go out on Facebook. I won't even look at Facebook because there's so much anger and there's so much misinformation, or somebody pulls a quote out of this study or this article and then they try and use it to express a point of, I laugh when people say, well, this whole thing's a hoax. Well, go hang out in some hospitals. I mean, people are dying, period. 60,000, I don't know what the number is today, but I know it's over 60,000 in the US.
In 2 months.
Yeah, in a very short period of time. This is real. And unfortunately, politics plays into way too much. This is about science. This is about people. This is about people's lives, their families. And we have to come together as a country. We have to come together as a community. And people need to, quite frankly, open up their minds to not what they're seeing on the news or reading in the newspaper, but just step back and say, what can I do to help the person next to me? And honestly, if we just follow these simple things, and they are pretty simple, then we'll get rid of this darn virus and we'll move on back to the old normal. But, and who knows if the virus is going to go away? Is this going to be something that's now we're going to deal with every year going? Who knows? Have no idea. Is a vaccine going to be out soon? Don't know. We don't know. We know that the original SARS virus that we all heard about, many years ago, we don't hear about it anymore. Let's keep our fingers crossed that we have the same thing that happens with this virus, but time's going to tell. But what we know right now, today, based on the science right now, is we have more control than we think in a community to help each other than we do just sitting back and doing what we always have done. If we do what we've always done, listen, this is going to continue to spread. We have challenges in our country. You got to remember, most of our states are the size of other countries. And so as we look at people traveling from Michigan to Ohio, to Illinois, to Indiana, to wherever, we have such a bigger risk in our country of people moving it from one area to another, and air travel and everything else. And I'm not saying we shouldn't do these things, but we should do them. And again, let's protect those around us.
You talked about a vaccine. Every time there's announcement of progress toward a vaccine or some kind of antibody therapy treatment, the markets get really happy about that. And here in Michigan, Pfizer and its Kalamazoo campus, talked about having 75 scientists dedicated 7 days a week to work on this, and they feel like they're getting to the point where they may be able to start producing these by fourth quarter of 2020. But then I have friends that are in the research business and are running assay testing, or immunologists that say there's no way that something can be done by the end of this year. Just based on your experience, not calling anybody out, but what's generally the timeline to expect something like that? Because obviously a vaccine is what returns us more to normal.
Yeah, it's a tough question. The only thing I can reference back to is HIV. When HIV started, some of the legislation changed, allowed for, I think it was called orphan pharmaceuticals, but basically they didn't have the same level of scrutiny that meds used to have when they were trying to find a treatment. And we created some pretty cool drugs. And in a relatively, though it was many years, in a relatively short time. I mean, you got to remember, it used to be everybody who got HIV universally died. And now they generally live. So why do I use that example? I think we've never seen the level of cooperation among companies, the number of scientists focused on creating a vaccine. But there's a lot of steps in it. I mean, you're identifying what part of the virus you're trying to build an antibody against, so that you're going to use in your vaccine. You've got, animal testing. My understanding is that I've read, as best I can tell, some of that has been done on chimpanzees. Then you have live human testing to look for side effects. Some of that has started. And then you have the whole efficacy piece. Okay, now that we know that, okay, it looks good in animals. Yeah, it seems relatively safe. Here are the side effects. Now, does it work? There's many things that feed into that. Influenza, right? Every year it's a new vaccine. Why is it a new vaccine? It's a new vaccine because that influenza mutates, and it mutates pretty quick. So every year the scientists get together and they guess, here are the strains we think it's going to be, and they build a vaccine against that. Some years they do pretty good. This year it was only 40% effective. So what we don't know, though the belief is that coronavirus doesn't mutate as fast, we don't know. And you got to remember that coronavirus, 4 strains of it alone that we know of caused the common cold. We still haven't come up with a vaccine against the common cold. So a lot of I don't know, so I apologize for that, but I think it's going to be, many companies are working on this, many scientists are working on this, so let's hope they come with a breakthrough. But I think it's going to be, we're going to have to see what happens. I think we all hear the news where it's touted there'll be a vaccine by the end of the year, and yet we all hear then the medical community saying, yeah, I doubt that. I don't know. I think we're going to have to wait and see.
So on a side note, my past job, I used to work for St. Jude Children's Hospital on the fundraising side of things. and they were one of the prime developers of the flu vaccine. And they were always, like you said, 2 to 3 years ahead of so if I were getting the flu vaccine, if they were creating it now, it's for 2023, 2024. And they were, just developing it at that. So it's a fascinating process.
Yeah. And it takes time. It does take time. Well, and then
we're not a very patient society.
Well, and let's say you have the vaccine, right? So now you develop one. Let's say it works. Now you got to say, wow, how do I get this out to all these people? Can I manufacture enough? Do I have the supplies to administer it? Have I manufactured enough of those? And then how do I get it out to all these communities? Who's paying for it? Is it an insurance thing, non-insurance? Is it going to community health? How do we get out to local clinicians? If we give it, does it last for a year and you have to be re-immunized, or is it something that lasts long-term? I mean, there's so many, like hepatitis B generally lasts pretty long for most people. We'll check antibodies, and sometimes people have to be re-immunized, but again, this is all new. And so, from a science standpoint, it's fascinating. I wish we didn't have to be fascinated by it, and it wasn't happening at all, but there's so much unknown that we're going to learn over time.
Well, Dr. Schwartz, this has been a great conversation.
Yeah.
I really, truly appreciate your time on this. We had the conversation last week. I immediately thought when we hung up, like, I really want to have you on this COVID cast. And for your information, this is available to the greater Sterling Heights and Macomb County business community. And as we repost this on social media, where there's a lot of people that will pick this up all over, Southeast Michigan, which is where we hope these all go to, because I think they've been all very helpful. So I just want to thank you and your team for providing all the insights the last couple of weeks. And thanks for being here today. Thank you so much.
Yeah, this is great. Thank you.
Everybody stay safe.
Thanks.
Okay,
Have a good day.